we examined kind of the real world um, use of the Apple Watch hypertension notification feature, which Apple did their own validation study and found a a certain sensitivity and specificity, which tells you how a medical test kind of behaves or works in isolation. And what we did was we calculated the prevalence of undiagnosed hypertension in the US adult population using a national representative survey to tell us kind of how the test might perform in real world populations. What essentially the finding of our report is that the prevalence of undiagnosed hypertension varies widely across different subgroups by age, by race, by socioeconomic status. Um, so what this means is that basically the trustworthiness of a positive test is higher in groups that have a higher prevalence of undiagnosed hypertension. Okay, and that's the table one um, in our report. Okay, so that's about the trustworthiness of a positive test. And the opposite is true with the trustworthiness of a negative test. Um, the groups with the lower prevalences of hypertension, younger adults, etc., the the trustworthiness of a negative test is not as good. Okay, so the risk there is this idea of like being falsely reassured that you don't have hypertension. And the reason this is important is because the U.S. Preventative Services Task Force, the ACCHA guidelines recommend cuffed devices like the standard blood pressure cuff that squeezes your arm in the doctor's office to screen for hypertension. Um, so our paper just kind of paints the landscape of how the Apple Watch hypertension notification feature will perform in these subgroups where the underlying disease, in this case, quote unquote disease, is undiagnosed hypertension. So that gives clinicians and consumers an idea of how trustworthy is a positive test and how trustworthy is a negative test. So I think that's where our report is helpful. Is it guides clinicians where a negative test might be more trustworthy, and that's in the groups with the higher prevalence of the disease. Hypertension is what we call the silent killer, right? It hits asymptomatic most almost all the time. You don't know that you have it. So any technology used to help increase screening is good. Okay. And the specificity of Apple's test in the validation study was 92%. Um, so that's good. Um, so in general, this is a good thing for public health, or that part of it's a good thing for public health. The one potential risk is false reassurance among people who don't get an alert. That's the key, um, especially among younger people and people with a low baseline prevalence. Well, I think in general, the U.S. could do a better job of preventive health care and screening in younger people. Um, and I think wearables and Apple Watch, given the prevalence of use, is definitely one avenue into engaging younger people in healthcare. Um, so I mean, I think this is a positive step forward for sure. If and if we just got to remind people that it's not perfect and that there are better tests, but they require a blood pressure cuff, which is less convenient, right, than a watch. Oh man, great question. So what we're working towards is is technologies and tools to reduce clinical inertia, which is very high and one of the leading causes of why blood pressure control rates are not as good as they could be. Um, right now, the Apple Watch hypertension notification feature is only designed for people without hypertension, without a diagnosis of hypertension. So it's not intended or designed for like treatment and monitoring of people on on antihypertensive meds. But to your point, Ryan, um, tools like wearables or home blood pressure monitoring to help reduce clinical inertia are very important, are currently under study, and we're hopeful that they can kind of add to the toolkit that clinicians have to help provide, um, the best management for patients with hypertension to improve control rates. Like, what did what does our study add, to the Apple validation study that they did? And I think what ours adds is by calculating the real world prevalence of the disease, so in this case, undiagnosed hypertension within these subgroups, is what turns the sensitivity and specificity in that validation into like the real world impact among US adults, especially like for a screening tool that millions of people with very different risks, are using. So it helps clinicians understand perhaps when they're treating a patient, uh, the informativeness, so to speak, of an alert or the absence of an alert.